Well, joining us on the program this evening, very shortly, we are going to go across to Meerut, where we'll get the doctors who perform that in vitro fertilization. We're also going to get Durusha, gynecologist from Mumbai, and of course, well-known consultant fetal medicine, Dr. Puneet Bedi joins us here in Delhi. Dr. Bedi, to you first. When we first spoke to the parents, they said, yes, we are 70, the mother is 70, the father is 76, yes, we have daughters, but it's our life, it's our choice. So we are not sure what this whole debate is about. When someone says that to you,
well,
what can we do?
See, all through the whole controversy of female foeticide has been made out to feel as if it is an individual's right or individual morality which decides whether you can have daughters and have sons and kill daughters.
Right.
Now the desire for son is thousands of years old, but the means have been provided by technology. Now every technology which sells has been sold as a scientific background. While science seeks truth and knowledge, technology makes profit. It's as simple as that. Technology is never developed for the advancement of medicine. For example, no new technology has been developed lately to develop anemia or even to reduce, to make blood banks safer in this country,
right,
and reduce maternal mortality.
But there are all those people who are perhaps watching, sir, this evening, who've perhaps used in vitro fertilization because they tried all those years and are happy with boy, girl or whatever else that they got at the end of the day. So there are all those. This is perhaps the dark side of technology?
Absolutely. See, technology will. Now, the point is not only are individuals made to feel as if they have a choice to kill daughters and have sons only.
Right.
The individual entrepreneurs who run these so-called fertility centers are
right,
also given the choice. Actually,
right,
if you really look into it, twins is a complication of an IVF procedure,
right,
but it made to look as if it's a two-in-one kind of one-for-one free,
right,
which is how. So that means there's no informed consent. There is not enough information.
Right.
There are no guidelines and
right,
there are no restrictions.
Right, important points there. I'm going to get the doctors who performed that in vitro fertilization, performed what the family calls a miracle, the fact that they've got this boy after 6 years. Remember, they're saying they don't want the girl who's come with the boy, they got twins. But let's now go across to my colleague Anchal, who joins us from Meerut. Anchal, the big question, of course, is the age of the couple, but as Dr. Bedi here is saying, what about, were the parents told about all that this would involve? They're now saying they don't want that little girl. Well, let's just go across to the doctors and ask them, before performing this treatment on them, did you tell the parents how risky it was?
Yeah, when we counsel the patient, we always say that because you are looking slightly older, there should be specific problems in your delivery or in your pregnancy, and they very well accepted the challenge.
And what about, did you tell them that it's going to be a boy or a girl? Or
No. There is it should be very clear in IVF, in test tube baby. There is no way to give a male or a female. There is no technology available in India or abroad that can differentiate male and female. Well, no technology available.
Well, Natasha, that's what the doctors here are saying, which is contradicting what the father of Charan Singh is saying. Back to you. Anshul, just stay with us there, more on that. We're just going to come across to you in just a bit. If you were this doctor, Dr. Bedi, or if you had something to say, you heard what the doctor said, we told them, we said that, okay, your wife is 70, you're 76, and we informed them of all the risks. Is it more of a doctor's responsibility at this stage?
Absolutely. There are, very, very few clinics in the world accept mothers older than 40 or 50. So all this it is completely market driven. Right. The demand has been created. It has been inculcated to say that, 20 years ago, no 70-year-old even demanded a child. So they, obviously, in any kind of marketing job, you say one thing in public and another in private.
The option exists, you're saying, and people know that.
Yeah, time and again, in private, the patients are offered or in fact promised the earth, and of course in public they will not accept because it's illegal. The doctor is saying that it's not possible to differentiate. Of course it is possible to differentiate by PGD and pre-implantation genetic diagnosis to make a male and female, and it is completely illegal, so obviously nobody in public or television will accept that they did it.
Right. Dr. Durusha, you're perhaps someone who knows the desperation of such couples better than most of us. What would you say? Now, we've got this one snapshot here, really, of this man picking up his wife. Remember, he's a 70-year-old, he's a 76-year-old, actually, and she is 70-year-old. We're just going to try and bring that up for you. That's perhaps the defining moment for us in this report. They are grandparents. They have 6 grandchildren, actually, from those 2 daughters that they have. Dr. Durusha, these are essentially made-to-order babies. How far should one go? Who draws the line in such cases?
I think it's basically the responsibility of the doctor who's handling the patients, and it is their responsibility to let the patient know what they're going in for, what problems are involved, what are the risks involved to the mother of having a pregnancy at that age. And the fact that, you know, when the child is born, I mean, what is the life expectancy of that mother further? Who's going to attend to the child later? So there are problems both for the mother and for the child. So honestly, it's a responsibility of the doctor, I think.
Right, Dr. Cha, several middle-aged couples, particularly in the West, are often not even allowed to adopt because they are told that they are too old to have a young child, and here we are allowing them to conceive. What sort of message is being sent out? And as I was asking Dr. Bedi, shouldn't the role of the doctors in question be more under the scanner?
Yes, I think so. As a matter of fact, we do have some kind of national guidelines which have been laid down. Unfortunately, those guidelines do not mention what could be the maximum age at which a woman could bear a child. They do have guidelines on, you know, at what age a surrogate mother could bear a child, and they do have guidelines at what age a woman can donate her oocytes. But unfortunately, there is nothing mentioned as to at what age a woman could be allowed to undergo assisted reproduction.